So what should you expect after lobectomy? There are several common complaints that patients have. The first one is pain. It doesn't matter the type of incision that you get, you will have pain. Now, what does matter is the degree of pain, and how long that pain lasts is dependent on the size of the incision that you underwent to have your lobectomy. Consequently, if we're able to do the operation with minimally invasive techniques, patients tend to have far less pain than using a large chest incision, which is classically called a thoracotomy. You will have some change in your breath. Generally, you will be short of breath for some period of time. Depending on how poor your lung function was before your operation, that period of shortness of breath following the operation will vary. Patients that have normal lung function before their operation will have shortness of breath syndromes that may only last for 3 weeks. However, patients that had very poor lung function prior to their operation may have shortness of breath that lasts for 3 to 6 months. And shortness of breath in those patients may be part of their life after the operation. Some patients will develop a cough. And this is usually self-limiting, usually ends up diminishing within the first 6 to 8 weeks after the operation. And some patients will have fatigue. And fatigue is often due to deconditioning that occurs after the operation. Your muscles become weaker, you're not walking as much as you were before, and consequently, when you start to ambulate and walk, you feel fatigued because your muscles are weak.